Good afternoon, everyone. My name is Zeb Little, and I will be presenting for our Group 5, made up of Jacob Castleberry, Harold Gaines, Megan Newton, and myself. We would like to welcome you to Group 5's presentation on why operational strategies are not the key to successful outcomes in the healthcare industry. As part of the Week 6 debate, we have taken the con position in this debate. Today we will discuss what exactly operational strategies are, why they are not the key to successful outcomes in the healthcare industry, what the actual key to successful outcomes in the healthcare industry is, on with examples highlighting this key, and we will wrap up with our conclusion and resources. Organizational strategies are the concrete actions that increase competitiveness, profitability, and performance, and details exactly how a corporate strategy is implemented to increase a firm's customer-driven focus. Operations and operations management are utilized in healthcare for the day-to-day practices in administrative, financial, and legal sectors to maintain and enhance client experience and organizational goals. However, with operations management overseeing the day-to-day practices, operational strategies, which are also considered a micro-focused strategy with day-to-day and weekly goals being the focal point, how would a hospital or health system prepare for the future a year or even years down the road? Operational strategies allow for reactivity to events already occurring. They do not allow for much more beyond a week or month in advance, thus a reactive response is needed when utilizing an operational strategy. In healthcare, hospitals and health systems must be prepared prior to an event, whether good or bad, happening. They cannot be reactive, they must be proactive. Operational strategies are important, but they are not the key to successful outcomes in the healthcare industry. More efficient processes do not guarantee patient satisfaction and service quality. Healthcare workers commonly create workarounds when encountering operational failures that decrease efficiency and increase the risk of medical errors. Poor communication and form filling by staff in place of analysis leads to poor results. So what is the key to successful outcomes in the healthcare industry? The answer is strategic planning. Strategic plans offer a broader plan to get from where you are to where you want to be and are a goal you want to reach. The plan itself is the path to that place or goal. Operational strategies are often focused on very specific operations involving day-to-day or weekly actions. These strategies do not fit an overall health system and are often utilized for specific tasks at hand, thus making strategic plans a better fit for a rapidly changing healthcare industry. Strategic plans allow for proactive, agile, and efficient strategies and proactive planning that better suits the rapidly changing and evolving healthcare industry, as well as potential events that will affect the healthcare industry that strategic planning is capable of accounting for. One example of strategic planning being utilized in the healthcare industry is by the American Hospital Association, or the AHA. The AHA is a healthcare industry group founded in 1898 in Cleveland, Ohio, that currently includes nearly 5,000 hospitals and healthcare providers. The AHA developed the strategic plan shown here that was utilized by the association itself and by the hospitals and healthcare providers within its group. Their strategic plan was centered on 4 areas of focus: access, health, innovation, and affordability, and 4 strategic goals, 1 for each area of focus. The AHA looked at their existing strategies and strategic plan, as well as current and future trends and realities, while meeting with its members to develop a strategic plan to achieve the strategic goals they outlined for 2019 to 2020. Another example of strategic planning being utilized in the healthcare industry is by Carson Valley Medical Center in Gardnerville, Nevada. Carson Valley opened in 1993 and today includes its hospital, behavioral and occupational health clinics, wound care and cancer care clinics, sleep study clinic, urgent care, multiple primary care, internal medicine, and family medicine locations, surgery centers, and diagnostic and women's imaging centers. As its October 2021 groundbreaking, a massive expansion project is underway, adding a rehabilitation and sports medicine center, cath lab, expanded pediatric physical therapy programs, a new vestibular and neurological rehab program, and the foundation for future robotic surgery. This project is expected to be completed in early 2024. The expansion project for Carson Valley is part of their 3-year strategic plan. The strategic initiatives that Carson Valley outlined in their strategic plan for each strategic goal that they set are being addressed through the expansion project. Through analysis of the community's needs and Carson Valley's needs, as well as the changes that previously seen in the healthcare industry and those anticipated to happen, Carson Valley developed their plan for their current needs as well as the potential needs they might encounter in the future when caring for their community. Carson Valley was able to account for potential future events and needs because strategic planning allows for proactivity instead of reactivity. Operational planning would not allow for an extended plan or such a massive expansion project with the future at the forefront. In conclusion, operational strategies, while a great asset for day-to-day or weekly actions, are not the best fit for the healthcare industry. Strategic planning allows for proactive planning over an extended period of time with a broader view that encompasses the mission of the hospital or health system, strategic goals and initiatives, and the path to reach and achieve those goals. Overall, strategic planning sets the healthcare industry up for long-term success and is the key to successful outcomes in the industry. This slide shows the resources that we used in developing this slideshow. We look forward to hearing from you and participating in this debate. Thank you. We look forward to hearing from you.